Hello, everybody. Dr. Patel here for our Facebook Live. Hope everyone's doing well. I've been away for the last couple weeks. I do apologize. Hope everyone had a good and happy Thanksgiving. And we're excited to get back on with some Facebook Lives every week here. And really, really excited today to have a special guest, my dear friend and colleague, Dr. Heidi Gastler.
Hello.
And if you hear some barking in the background, that's her soon-to-be service dog, Doc, who's down there waiting patiently for some treats. But I just wanted to say thank you for joining, because this is going to be a really good episode. The idea behind this episode came really from the fact that I've had a lot of patients asking about, hey, there's Doc, say hi. I can't take enough of that face, or I can't get enough of that face. But I had a lot of patients asking me about CBD, and I have a lot of patients that are using CBD for pain and for various other conditions. And really, the research on CBD has been growing over the past several years. But I myself am not an expert. I am not a pharmacologist, and I have not been in the CBD world as far as medicine is concerned. But I have seen the benefit of it with a lot of my patients. So I wanted to really dig deep into this, and that's why I reached out to Dr. Heidi Gastler here. She is really first and foremost, she's an amazing physical therapist, and we've shared a lot of patients together. We actually have some videos on my website or on Facebook. You can take a look and see a previous interview that Heidi had done with me a couple of years ago now at this point.
Yeah. Without the masks.
Without the masks, the good old days, as we call it now. A while ago, Heidi got into using CBD to treat her patients, and I knew that, so I really wanted to bring her on this episode and pick her brain about what that means and what that's like, her personal experience and her experience treating patients with it. So without further ado, Heidi, if you could introduce yourself.
So my name is Dr. Heidi Gastler, and I'm a physical therapist, and I own a practice called Mountain to Sea Physical Therapy. Our main location is in Manhattan Beach currently. And let me preface this that I am also not a cannabis expert. I would like to say I'm an armchair expert and avid consumer on the CBD scale, both for myself and my patients. But I've had a lot of success using CBD both for myself and my patients over the last 5 or so years, and really feel strongly about using it in a medical space, and I'm here to share what I've learned with you guys.
So first and foremost, thank you so much for coming on.
Anytime.
I really value your opinion and your true expertise, because even though you're not down in the depths of doing research in it, you've been using CBD for your patients for quite some time.
Yes.
And you mentioned also that you've been using it for yourself.
Yes.
Tell me more about that.
So my experience kind of getting into this space was that it started where I had patients coming in who were not good surgical candidates, and were like one guy in particular, he had a really shredded rotator cuff, and this guy was in his 70s, was an avid scuba diver, was lifting a lot of heavy scuba diving gear, and he had a lot of medical conditions that made him a really poor candidate for shoulder surgery. He was in a tremendous amount of pain, but was trying to get off the opioids, and one of his physicians at the time suggested that he try topical CBD oil or cream, and he had a tremendous benefit. And this guy went from reporting that he was in like 8 out of 10 kind of pain all the time to saying like, wow, I really don't think I need surgery anymore, and I can do everything I want to do. And this got me really interested, especially with this particular patient, in exploring this. And at the time, I was doing a lot of prone paddleboarding for long distances, like Catalina Classic, if anyone's familiar, which is a 32-mile paddleboard race. And I myself have shoulder tears on both sides, and was eating Advil at the time. And we were talking like eating like 800 milligrams of ibuprofen, 3 to 4 times a day, and really kind of wrecking my stomach. So I started exploring the same type of products with the CBD topicals at first, and was able to, with kind of a combination of more conservative therapies, being CBD, doing rehab and strength training, and then actually PRP with Dr. Patel, I've not only been able to avoid shoulder surgery for years, but I've also been able to continue a very active lifestyle of prone paddleboarding, powerlifting, kind of you name it, including a lot of overhead activities that I wasn't able to do well before, and have found a tremendous amount of benefit.
I mean, I think it's really amazing the amount of things that you've been able to do with your shoulders. You know, when you first came to me with your shoulders, I mean, it didn't look pretty, and we talked about the idea of doing PRP for the shoulders, but I was like, look, you know, it may take more than one treatment. We may need to consider something a little bit stronger, because ultimately we wanted to try to avoid surgery, and we wanted to get you back to doing the things that you wanted to do. And I think that really it was the combination of doing a treatment to help the integrity of the tendons, but then also being able to manage some of the inflammation and some of the pain associated with your activity with things like CBD that I think was really tremendous. So I've heard this story before, but I think that everybody really needs to hear a little bit more about the last Catalina Classic that you did, and the adventure that was. I got to give you the mic for this.
So let's start here. So I'd done PRP with Dr. Patel after one paddleboarding incident. And then I didn't need to have it again because I was able, with the use of CBD, I was able to manage my pain, strengthen, rehab the shoulders. And I didn't re-injure the shoulder until a couple of years later, and that was the second round we did. So a lot of people ask me all the time, like, well, how many rounds did you have to do? And the answer is one. I wouldn't have had to do another one, except for I was an idiot and did the same thing I tell all my patients not to do, and injured myself. Shocker. So we did a second round of PRP, but it was a couple of years after the first. And did the same thing, used the CBD products, did the rehab, and did another Catalina Classic, and it was not a pretty race. So let's start there. I had a really tough year, both physically, the conditions were really bad, and it became not so much of a race as a survivalist event. And I'm not proud of this, but it took me 9 hours and 53 minutes to finish paddling, but I just was not in the mind frame of giving up. And at mile 16, I had a white shark chase me, had to have my boat intervene, and I have no fear of sharks, but this shark was a little too interested in me, and it became quite the adventure day, that's for sure. But 9 hours and 53 minutes of paddling with my arms only, no paddle here, and I didn't re-injure the shoulder. The shoulder stayed intact. I was able to manage all of the subsequent pain, which, you know, I didn't have a great day of a race, but as an athlete, you have these off days, and still being able to not get re-injured and manage my pain, I think, was pretty incredible.
I mean, I think it's a tremendous story, and it's a testament to a few different things. Number one, it's your athleticism as well as your drive to do the proper things, you know, right? To use your body properly for all intents and purposes, to do the rehab, the exercise that's absolutely necessary, to do things like PRP to keep the tissue healthy as much as possible, but also to use some natural ways of reducing the pain and inflammation without having to resort to stuff that could actually damage you.
Yeah.
Things like opioid pain medications that could hypersensitize the area, or the non-steroidal anti-inflammatory drugs, which ultimately have a lot of other side effects associated with it. So it's really, really interesting. But I do got to pump the brakes for a second and stop and say, she was chased by a shark. And afterwards, we talked a few months, actually it was a long time after that you told me this story. We'll get into when you told me this story in a second, but you told me this story, and ever since then she's been sending me articles and telling me how safe it is to swim with sharks, and that sharks are not harmful
sharks.
creatures. So, the thing that's preventing me from taking up surfing is because of my probably unreasonable fear of sharks. But I gotta say, amazing, amazing story, and really, going back to it, it's a testament to what you do for yourself that you prescribe to your patients too.
Yeah, and that's a huge thing, is it has to be a combination, and it's not just one thing that solves the problem. It's like you're doing lifestyle and activity modifications, you're doing interventions to help you along the way, and really like trying to stay away from like the more heavy duty medications, like with just like the ibuprofen amount I was taking, and I wasn't on any opioids, but just the ibuprofen amount I was taking, I was already having more gut problems, having intestinal issues, and noticing effects of that in a really relatively short amount of time that I'm now able to completely avoid by using the CBD type products and avoiding the ibuprofen.
So I definitely want to delve more into CBD and your experience with it. Are you still using it now? Why? What other life experiences have you had that this has been an applicable benefit for you?
Yes. So speaking of stories, back in August, I thought that I was having a TIA, or a mini stroke. And the reason I thought I was having this is I started having kind of the feeling of an onset of a migraine that coincided directly with having foot drop on my left side. And this led me to getting an MRI, which I was very fortunate that I have friends who were willing to listen to me and order an MRI for me, because I wanted to check and make sure I hadn't actually had a stroke. What we found was a very large brain tumor that I wound up having to have removed in an emergency procedure 3 weeks later. And after I had the brain tumor removed, I was in the ICU for several days, and we had an incredibly difficult time getting my pain managed in the ICU, which was a problem because I needed to get my blood pressure down so we could get the swelling in my head controlled. And what I found incredibly interesting was that I had a very poor response to narcotics, but as soon as I got out of the hospital, my brain surgery team told me that they were happy for me to restart on the CBD and medical marijuana products. And once I started on those, I was able to sleep again. I was able to get the pain under control, get my blood pressure managed because the pain was under control. And I just thought it was really cool that my brain injury team was progressive enough to be like, use the marijuana, like go for it, and encouraged me that that was a safe and okay thing for me to do. And after I got out of the hospital, I was able to get off all narcotic medication very quickly and switch to, again, just more of these natural products. And at this point, I'm using some sublingual oils. I'm using some gummies at nighttime, which we can talk more about. And I've also been using a topical application kind of on the actual surgical area to help with inflammation, pain management, sleep, anxiety related to having a very large unexpected surgery this past fall. And it's been a really interesting experience in general, but also from this perspective of really kind of seeing what the CBD can help with a much more major procedure than my shoulders were, and also exploring more, again, being kind of an armchair expert about the neuroprotective effects of marijuana as well, including anti-seizure, potentially antifungal, potentially anti-tumor growth type of things, which these are all things that are being studied now, and there is not like a consensus, but these are all things that the community who studies medical marijuana thinks are potential benefits of this, and if they are, those are all great news for me.
I mean, it's really a tremendous journey that you've been through. Everybody talks about 2020 being crazy. We'll talk about a crazy experience here. I remember when you called me when you were having your foot drop,
yeah.
and things weren't lining up, and I was like, yeah, you should probably get this checked out.
I think you told me I needed to go to the emergency room, and of course I was like, nah. All the symptoms went away. I'm fine.
Yeah, I was like, it's not normal to have these symptoms regularly. But in the end, I'm glad that you went you found a great surgeon. You did your research in a very small window of time,
Yeah.
and really were on top of everything. So honestly, for all joking aside, we're blessed. We're lucky to still have you with us.
Yes.
And I consider you a close friend, and honestly, like it's amazing that you're here.
Thank you.
And the truth is that I think that you're, all things considered, doing pretty darn fantastic.
Yes.
The road to recovery is not nearly over.
No. I wish.
Yeah. But I do have to kind of circle back and say that it's really cool that the neurosurgery team, liked the idea of using marijuana, liked the idea of using CBD for pain control. There's something to be said about that, right?
Yeah. If you've got something so big and your team who just literally saved your life is saying that this is something we fully support you using, I kind of took that as a big deal.
It is a big deal. That is a big deal. So, CBD has been around for a little bit. Let's delve a little bit into CBD, what it is. I think the way that it was discovered in terms of its medical use is actually an interesting story. You know the story of Charlotte's Web?
I do, but I'm going to let you tell that.
So it's well, I'll tell the story about how CBD got discovered for medical use, and then we'll talk more a little bit about the science behind CBD, as well as the other cannabinoids and the other components of marijuana. We'll go a little bit more into depth about that. So CBD, well, weed's been around for a long time, right? Marijuana's been around for a while, and we know that there's different ingredients in it. The most commonly thought of ingredient in marijuana is THC, which is the component that has the psychoactive properties of marijuana. CBD is one of the components that does not have the psychoactive properties of marijuana, but does potentially have a lot of different medical benefits. The interesting thing is the first medical indication for CBD, I believe the first medical indication for CBD was for seizures. And the story goes something like this. Now, don't quote me verbatim because I'm probably butchering the story, but basically there was a lady that had a daughter named Charlotte, and her daughter had intractable seizures, meaning that she would have seizure after seizure after seizure. And this was so profound that she was not able to live her life, that she was not able to go to school, she was not able to read, get educated, anything, because she would have seizure after seizure after seizure all day, every day. They had tried various different seizure medications, seen tons of specialists, and they were not able to progress her management of her disease whatsoever. So her mom, being a wonderful mom, doing the research that she was doing, was like, what else is out there for potential management of this? And she came across some little bit of nuanced research or something along those lines about the potential of CBD for management of seizures. So she contacted a bunch of different marijuana growers and said, hey, you guys have any CBD products? And everybody's like, no, that's the stuff that we don't want to concentrate because the THC is what gets everyone high, right? So for all intents and purposes, back then, they were not growing any marijuana plants that were more CBD heavy. Everything was more THC heavy. Eventually, when mom was practically ready to give up, and she had, in an interview I heard that she had talked about I wish my daughter was dead, right? Because then she wouldn't be suffering this much. Then one day she had a knock on her door, and it was a grower that said, hey, by the way, we have this strand that we've been growing that we mistakenly grew that has, it's abundantly CBD with very, very little THC involved. And long story short, they tried it, and it actually stopped her seizures. So significantly that this became something that they started to manufacture. It was called Charlotte's Web. And that was the first kind of real push into using CBD, using medical marijuana for the treatment of actual conditions. So it's pretty widely used at this juncture for the management of seizure disorders. And it was found that it had a neuroprotective effect, protecting the brain, And it also had an anti-inflammatory effect. So then more and more research started going on into the potential benefit for pain and other conditions that inflammation is the prior source of. We're still learning a lot about it,
Constantly.
and I still don't think we 100% even know purely how the anti-inflammatory effect takes place. But it's really fascinating, and I think that there's a lot of real potential future for this. But I wanted to ask you more, because you do know more about it than I do. Is what are the different components of marijuana? What do we know about what do we know about how it works?
So, when we talk about the components of marijuana, we're talking about cannabinoids, and there's a lot of them. Like again, don't quote me. I'm armchair experting here, but I want to say there's like 100 different cannabinoids. So CBD is one you hear a lot about. THC is another one you hear a lot about. One of the newer ones that we're talking about more is one called CBN. And what's kind of interesting to me is that CBD, like the space, as I understand it, has become so full of products that now they're really starting to research and expand into the different cannabinoids aside from CBD to see what other things you can use, because we all want to market, this product, right? A lot of the CBD on the market is actually derived from hemp, which a hemp plant is kind of the cousin of a marijuana plant. So you have things that like are a hemp oil. You're generally talking about a CBD product, but you should be careful with that, and making sure that you kind of know what's actually in this product you're buying. If it's not something that I'm carrying like in the clinic. So like clinically, I can have CBD products that have less than 3% THC. If you go to, say, the grocery store, it's the same thing. If you have something that has more THC than that, then you need to go to a dispensary. And here in California, you can go to the dispensary as long as you're 21 and over, or you can go with a medical marijuana card, I believe, over 18. And then that's where you start getting into products that have more different types of cannabinoids in them. So, for example, THC, they're doing a lot of research right now because aside from the psychoactive part of THC, they believe that may have its own benefits in terms of anti-inflammatory and some other things as well. And then CBN that I mentioned, from everything that I know about CBN, it's kind of a synergistic effect with the CBD and the THC. But you'll see products, and like one of the gummies I mentioned that I take, it is CBD, THC, and CBN, and it is meant to be a sleep aid. And so it seems to have a synergistic effect to cause drowsiness, so that if you're having like nighttime difficulties with insomnia, maybe anxiety, you're somebody who maybe has to take Ambien to sleep or a Xanax or something, this could be something that's more naturopathic to take at nighttime and give you a more natural sleep component. And the nice thing is that they're making these products now with such small dosages that you can kind of really tailor it to your needs, because everyone processes this so differently that what works for one person versus another, it might be, if you've got a big person, they might need a big dosage, or someone who's been using this for a long time. You have somebody who's smaller and more sensitive to things like myself, and trying to like take a tiny little gummy and cut it into a quarter and take a quarter is kind of a challenge. So now that they're making these things with smaller dosages, so you can either take more of them to create a bigger dosage or less of them to become a little bit easier. But the CBN, aside from being a potential sleep aid, they're also thinking it might have components in terms of being like an antifungal, antibacterial. So we might be seeing that kind of come up in the pipeline. There's some research having to do with CBN and I think MRSA, if I remember correctly, where they're using that as a component of trying to knock that down. There's also, again, some potential for anti-inflammatory, which you kind of see across the board. And then aside from cannabinoids, and like I said, there's a lot of them, there's also things that are indica versus sativa. And those are the different strains of the marijuana plant. And you've got the indica, which tends to be something that's more a depressive, not depressing, but kind of more like an alcohol, where it's a more depressive thing, versus sativa is more an uplifting kind of a high. So depending on what you're looking for your effects and kind of how your body processes this, you may find that you look for a product that's kind of more or less one or the other. You also see things that are kind of a hybrid blend, which they say is more of a balanced. So for myself, I don't do well with medications that bring me up, like at all. And so I tend to look for things that are either a blend or something that's more of an indica based to help to kind of calm my system down. And I find that that works better for me. Or I look for something that's a blend. And then another part of this that I don't frankly know a ton about, but if you go to a dispensary, they will talk your ear off about it, and they know a ton about it, is terpenes. So terpenes are the part of the plant that creates scent. So when you're talking about a bud and you're talking about like the flower, a lot of them have different smells. So sometimes they smell like pine tar, or they might smell like fruit or a lemon, or have like a citrus smell. And these different terpenes, which are the smell, all have different potential benefits as well. So this is something that's being studied, and frankly, I don't know enough about. But that's something that if you're not looking so much in like the oils, the tinctures, and like the edibles, which is like what we're talking about more here today, if you're talking about actually smoking or vaping, that's something that you would want to consider, is looking at the terpenes and seeing what benefits those might have to you, and talking about that with somebody at dispensary to help to find somebody to really kind of find the effects that you're looking for and the benefits you're looking for.
This is absolutely fascinating.
The whole thing is like just a rabbit hole of information.
Yeah, I think there's so much information that we have. It also seems like there's so much information that we don't have.
Yes.
So I find myself trying to do a little research on this in preparation for this discussion here, and I found out that there's a lot of people that are claiming a lot of things and trying to sell products based off of those things. Whenever that type of thing happens, I always take a step back and I'm like, all right, what exactly are we dealing with? What does the actual research show? So what we're discussing here is a lot of the potential benefits of these CBD type products, or these different marijuana products. Just so you guys know, there does seem to be stronger research for a few different things, primarily seizure disorders, as I mentioned, pain, anxiety, also insomnia, or having difficulty sleeping, and then also for hunger. For hunger after cancer, and things like chemotherapy, and things that may suppress your hunger. This could be used for improving that. But
that's something with the THC, that's one of the things they talk about. THC is an increasing appetite. I mean, everyone's heard of the munchies, right? And so it's like you're basically purposely causing the munchies to try to get yourself to eat. So if somebody is, say, doing chemotherapy and they feel like they can't eat, they're actually using that in a way, a medical way, to try to get people to eat more of.
Yeah.
And you mentioned seizures a couple of times, but the other thing is that there's a lot of evidence having to do with things like Parkinson's and other neurological conditions, where you'll see these incredible videos where you'll see somebody who has a Parkinsonian kind of syndrome, where they've just got this constant tremor. You see them vape or smoke some marijuana, and then you see the tremors just stop. And it's really incredible. And we should be clear that like not everyone responds to this the same way, but there's a lot of potential here, which is really cool.
Yeah, it's really great, because I think that there is constant research that is being done in these. And I think that there's a lot of potential for a lot of different things. We do have to be careful that we don't fall for the trap of, oh, this is going to be the cure-all for everything in the world, right? Because if you've tuned in with me in the past at all before, and I've talked about things like stem cell clinics that are saying, hey, we're going to inject stem cells and cure your this and that. The truth is, with any fascinating, exciting, advanced technology in the medical world, there's also people that are trying to take advantage of it, and really just make a buck off of things that are potentially dangerous too, right? So that being said, we're hearing a lot of the good stuff about CBD and marijuana products. Tell me more. What do you know about the side effects of it?
So there are a number of side effects. Obviously, just like any other medication, you shouldn't be, say, driving a moving car or operating a motor vehicle of any sort. especially if you don't know how you react. And I tell people this from everything, even as a topical, of oral tincture, anything, even if you don't think you're going to react. For example, I have a patient who's 91 that she uses a topical CBD cream on her knees. Okay, she's using it in order to try to manage an arthritic condition. She's, again, not a great surgical candidate, but the first time she used it, she felt a little weird in her head. And CBD products are not supposed to do that, but she's an older woman, doesn't use much. And so I always tell people, like, when they first start using these products, try this at home when you're not going anywhere, when other people are home with you preferably, and then you need to give it a couple of hours to take effect. And this is something that is a real novice kind of a mistake, where people will use a tincture, they'll smoke something, they'll eat an edible, and they'll wait like 20 minutes and go, oh, I don't feel anything. And then they double down. And now you're really in trouble. And this is where we see people having a lot of like really kind of poor experiences when they don't know what's happening, and then they get turned off to the product because they have this poor experience because they kind of overdo it, right? And so that's kind of one of the things is that, and you can have all sorts of things, like some people will experience, instead of a reduction of anxiety, some people feel anxiety with it. Some people, they have kind of this converse effect. Some people feel drowsy. Sometimes people feel like dizzy, or they might feel nauseous. And again, until you've tried this, you're not going to know what experience you have, but you want to start slow and with a small dosage and then work your way up. Okay, imagine if you've never had a glass of wine before, you're not going to drink a whole bottle, right? So you want to start with just a little bit, see how your body reacts to it, respect the fact that you're putting something new into your body and you don't know how your system's going to respond, and then build up. And do it in the safety of your own home so that you can control what's happening around you. You can control your environment so you don't find yourself somewhere unsafe or find yourself kind of in a bad situation, because we certainly don't want that. And that goes for anything, including even a topical.
I think that's a very important point too, because even a topical, any medication, right? If you put it topically, meaning on the source of your pain, let's say the knee for the example that you used in your 91-year-old patient, your skin does absorb stuff, right? And there's blood vessels inside your skin. There's blood vessels underneath the skin. So when you put something topical there, that can get into your bloodstream and then go elsewhere. So we do need to be careful about anything topical, whether it's a non-steroidal anti-inflammatory drug or something like CBD. But I think that's fascinating because, a topical medication typically, can be beneficial for a local area, but we do have to respect it. Even though it's not something that we're smoking or eating, we still have to respect something like that with the potential that there could be side effects associated with it. And this kind of goes with not only CBD, but it really goes for any medication that we use, right? Because, there are medications that'll, really have side effects associated with them if we overdose or don't use them appropriately, which really then goes down the line of how, as a patient, do we find out what product is a good product for a particular situation? Is it as easy as just going to a dispensary and asking advice? Do we need to consult with a medical practitioner to really see what's appropriate, what's not? What are the things that you typically recommend?
So with patients that come in to see me, if we're talking about things, like in terms of like pain relief, I generally have people start with either a topical CBD product or an oral tincture that's a CBD product. And those are some things that we have in the clinic setting. And so we can even try using the CBD on the patient, like in a clinic setting, and see how they respond. A lot of times we'll give people like a small sample to go home with and try and see how they do with it. And we might start there. If it's somebody who is not coming into the clinic, like for example, this last year we've been doing a lot of virtual stuff, I highly recommend people go to a reputable dispensary and talk to the people who work there, who this is their entire life. And there's a lot of dispensaries out there and a lot of good ones. There's a couple of them that are under a brand called Glass House, that I particularly like, and I think that they do a really nice job. They have very clean stores, very knowledgeable people who work in that store about what the products are. And I tell people, kind of like you'd go in to see your pharmacist at like CVS or Walgreens, you're going to go into the dispensary and kind of think about the people who work there as almost like an herbal pharmacist. And I have them talk to those people and kind of get a starting point about what products to maybe start with. And I tell them to start with one product. Don't buy the store, buy like one thing, try it. Either you like it or you don't. And if you do like it, kind of see what's in the product that you like. Like, is it sativa? Is it indica? Is it more CBD based, THC based? Is it a blend? Kind of pay attention to the ingredients, and then you can kind of start your journey at that point and decide from there what other products you might want to try. And there's a whole host of really cool things. We've already mentioned tinctures and topicals. There's also transdermal patches, which is an actual patch that you put on your skin so that you don't have to be rubbing, okay? And you put that on and it absorbs through the skin. Now, when you're doing that, you're putting it near the site of pain. So like if you have neck pain, you're going to put the topical or the transdermal patch close to the neck, okay? You're not going to put it on your knee. You're going to put it up close to the neck, and you can use it in that way and have another kind of an application. But something that, you know, you'd mentioned in terms of side effects earlier, and something I always talk to patients about too, is that if you're in law enforcement, or maybe you're an airplane pilot or something else where you can't have any THC in your system, and your job is dependent on that, and you might have random drug tests, you need to make sure that the products you're using have no THC in them, and it's a straight CBD product, no THC, because as we mentioned, you're putting this on and you're treating a local problem. That doesn't mean though that this doesn't get into your bloodstream, and you can test positive for THC with a randomized drug screen from using a topical product. And one of the things that we don't know a ton about is the degradation schedule of these medications. And so you may have used something a week ago, but it could still potentially be in your system, and we just don't know enough about that yet. Then I'm always cautioning patients to pay attention to that too.
That's a good call.
Because I don't want somebody risking their livelihood or a job for the sake of using a topical product, and something that we can get a CBD only product for. But you just need to be really careful about asking what's in your product and being an educated consumer. And if you are a novice to this and not an educated consumer, asking your medical provider like one of us, and we'll tell you what we know, even though we are not experts, we're only armchair experts here, or referring you to a reputable dispensary where you can talk to people who this is what they do all day long.
I think there's some valuable points there. First and foremost, before I forget, just talking about things like the transdermal patch, that's something new that I haven't heard about, so that's really cool. But thinking about things like transdermal patches and topicals in the areas of discomfort, one word of caution that I do have to say is, if it's somewhere like a knee, that's fine. When we're talking about the neck, just so we know, it's good to be in areas where the neck is painful, but if we're getting in areas like towards the front of the neck where you have major blood vessels that could then absorb the CBD or absorb what we're putting on there and take it elsewhere, then we need to really be cognizant of that as well. So if you are concerned, or if you have questions about where you can and cannot put things, again, talking to a medical professional, even talking to the professionals at reputable dispensaries could be really beneficial. On that note, whenever a patient has historically come to me asking, all right, where do I get these products? I've honestly before said, I don't know. So I've usually pointed patients to dispensaries that I've heard of that are more reputable, because you've got the small little dinky dispensaries where the people really aren't paying attention to what all the things that they're selling, but then you have small and large dispensaries that they really make sure that their staff are knowledgeable about the products that they have. It's really important to figure that out. And what we can do is maybe put together like a list of a few that we like, and we can include those in the comments afterwards for this episode. But it's also notable to know that there are medical professionals that are starting to use these products within their clinics as well. I recently connected with a company called Isospec, and I have given some of these samples out to some of my patients and found that there are some true benefits from this product particularly. This product was made specifically for sports injuries, recovery from athletic exercises and injury, and dealing with pain. So this is a product geared specifically towards that I'm going to be carrying in our clinic in the near future. But there are a lot of varieties of different products that are out there that really are meant for different things.
Mm-hmm.
So that being said, what are the different products that you carry, and what are the things that you use it for?
So in the clinic, we have a private labeled CBD topical and a private labeled CBD oral tincture that we carry in the clinic. And the topical cream we actually have packaged both as a muscle rub, as well as, believe it or not, a chapstick.
Oh, interesting.
And I'll talk about a couple of more kind of interesting applications. And as an athlete, somebody who skis and is in the sun all the time, is in the salt water all the time, and we're talking about inflammation, one of the interesting applications of CBD is if you're using it on your lips, is actually healing those sun wind chapped lips. There's also actually some information, and this is not why I carry it, but there's also some information about using CBD to help reduce pain and inflammation from something like a herpes, like a cold sore. And that's something, again, if you were to apply your topical cream on your lips, for example, you could potentially use it. So we have it packaged that way. Those are the only things we carry in the clinic right now. I like a lot of products that are available at dispensaries, and another really interesting application that you may not have heard of is it's a vaginal suppository. So one of the things that we haven't talked about yet is pelvic pain, things with endometriosis, for example, people who have PCOS, polycystic ovarian syndrome, and other types of abdominal or pelvic pain issues. And also some interesting things is using cannabis for women who are going through hormonal changes like menopause. There is a really lovely local company called Hello Again that, this is not a sponsored ad, I just love them. But I could talk about them literally all day, and if you go on my page, I did a Instagram live with them earlier in the year, the founders, and it's a vaginal suppository. And the nice thing about this is it's very discreet.
Sure.
The vaginal tissues are incredibly absorbent, and you're getting this product close to your system that's producing a lot of your hormones and close to this area where a lot of people are having pain. And what we found with this product, they have found with this product, is that it helps from everything from vaginal dryness to vaginal inflammation. You could certainly use this rectally too if you're not a woman, with hormonal changes and hot flashes. It also helps with pain, like pelvic pain, endometriosis type pain. So that, I think, is a really fascinating application that we're exploring, something a lot of people haven't heard about. And I recommend to a lot of our pelvic health patients that they explore that. And they also have a day and nighttime formulation with varying levels of THC in different products to help to support potential sleeplessness versus being a daytime type of a product. And I've used it, and I can tell you I felt no psychoactive type of response. I was like, wow, I feel like I'm having a good day. I don't really know what else to say about it. I felt like I was having a good day, but it was really mellow, really easy. It's something that if you're looking for something for the women in your life, I'd say definitely give them a look up. Other things that I like a lot is I have CBD tinctures that also have more THC in them that I can't carry in clinic because I'm not a dispensary, and I'm not licensed for that. But there's a line called Mama Sue's, and Mama Sue, I believe, is up kind of near Berkeley, and she has a line of different tinctures that are both for sleep, a relief one, and that's the one I've actually been using a lot of since I got back from this last surgery, and using that for helping to reduce inflammation body-wide, both in my head, through the rest of my body, dealing with the post-surgical effect. And then I've been using my own topical on my head. So I've had a lot of swelling that fortunately we don't see as much of anymore, but I was actually rubbing it into my head topically to help with the inflammation and kind of doing my own like scalp massage with it. And then lastly, a couple of things that I've been using for kind of as a sleep aid and helping just to kind of mellow me out is a couple of different products, one being called CAN, and it's CANN. And I actually brought them. I brought one for Dr. Patel also, which he can drink later. Again, not a sponsored ad. I just am kind of in love with them. And if you are somebody who doesn't drink alcohol like myself, this is a really lovely product for just social purposes. But in terms of medical purposes, this has helped me at night to just kind of mellow out if I just can't get my system to kind of calm down. And instead of taking something like a Xanax, for example, doing something more naturopathic, I found that that's really helpful. And also there's a number of different products that are like a gummy type of a product, and I mentioned these earlier. And this plus CBD relief, again, not sponsored, I just kind of love them, is another one that I really like. And this has the CBD, the THC, and the CBN in it. And the little gummies are such small dosages that you can either take a little or you can take a lot, and really kind of help to moderate your dosage. And I don't need very much. So instead of having to cut up a gummy that's a huge dosage into a bunch of tiny little pieces, this is super easy. And I found that products like this have been really helpful for me in moderating all the symptoms that I'm having. And again, staying off of all the heavy medications. I haven't been on any narcotics, any anti-inflammatories. It's just this stuff, which has been really fantastic. And of course, I'm doing the other rehab and whatnot, that is associated with my conditions. But I found that these are really helpful. And these are things that I'm telling my friends and my patients about and family about, because I really think that if they're helpful for me and I found them to be effective, that I should tell other people too.
And especially because the things that she has found helpful, this conditions for which she is treating, are things that there's legitimate growing research for.
Yeah.
It makes a lot of sense. It really, and it makes a big difference to put the research and bring it with personal experience, because that's when we can really see the benefit overall. And it's really interesting to see all the different types of products that are out there. You can't see my desk right now, but there's actually like a slew over here. So if you could raise up the can, and if people just want to see the different products that we have.
These are a couple that I brought over just as a show and tell of things that I love and adore.
And then the tincture.
Oh yeah, and this is the Mama Sue's tincture. And you guys can all sponsor me later if you want, but this is, again, not a sponsored ad, and just things that I love.
And then these are the type of things that we're going to be looking at. Isospec is the sports medicine type of formulations that we have, and they come in different varieties of kind of pain creams and salves and tinctures, and so far we've been trying these out with some of our patients, and it seems like patients seem to be liking them. Certainly, as I said before, this is not, it's not a cure-all. This isn't magic. This is something to really ultimately help with decreasing inflammation, decreasing anxiety, decreasing pain, potentially improving sleep, potentially having protective effects for the brain and the neurological system. A lot of great potential here. Still a lot of research being done. So please be careful about what you're doing, and certainly be careful of people trying to sell you a product and saying that it's going to cure everything that you got going on. But I think that this has really been an amazing discussion to really dig a little bit into, really not even digging too deep, but digging a little bit into what CBD products and cannabinoids can offer for patients.
Right. Talking about from like this more of a medical perspective versus a recreational perspective, and things that in our practices we found helpful. So
I'm going to answer just a quick comment. Norma Jean Reese said, "Thank you for informing us about CBD. I think a little THC with CBD works better for intense pain." So that's an interesting comment, because like Heidi was saying earlier, it's going to be a matter of finding out what works best for you, and doing that in the safety of your own home. doing that with the guidance of a medical practitioner, I think can definitely be beneficial. But so this has been fantastic, Heidi. If you could tell everybody how to reach you,
Sure.
tell a little bit more about your practice and how to contact you if they have any questions. I'd love to share that with the audience.
Absolutely. So like I said, our main practice is in Manhattan Beach. We also do a lot of virtual consultations and treatment as well, given this kind of current day and age. And you can find us online at mountain2cpt.com. That's all spelled out. So mountain2seapt.com. You can certainly message us through that portal. On social media, you can find us at MTN, the number 2 SEAPT. So Mountain to Sea, but just kind of an acronym, both on Instagram and Facebook. And we're more than happy to if you message us through there, you can find us easily. And our practice, we see orthopedics and sports medicine. We also see pelvic health for all genders. And we really find that those things kind of are one and the same, and you hear a lot of people who do kind of one or other. We do it as kind of a combination of things. And we really treat pretty much everyone from 8 years old all the way up to 100. We don't do developmental things. I send out to developmental pediatric therapists for that. But 8-year-olds, if your kid has a sprained ankle because they were playing soccer or tears something or is having growing pains, can handle all of that, all of your adult problems. The pelvic health things is a really big growing topic, and I know I mentioned like the Hello Again product, but we deal with all matters of pelvic health issues, and a lot of that ties in with orthopedics and sports medicine as well too.
Absolutely. If you're one of my patients, you may have heard me talk about the pelvic floor. I think it's such an important thing that people neglect, quite frankly.
Or don't know exists.
Don't know exists, and people talk about core strength, and everybody thinks about the core. But when you think about the core, it's actually, it's a cylinder with the top of the can is your diaphragm and the bottom of the can is your pelvic floor. So it's super important to have all factors involved when we're taking care of our spine health.
Mm-hmm.
So I think the pelvic floor is actually a really, really fascinating topic. I'm actually going to bring you back on so we could discuss the pelvic floor more in depth on a later date. But thank you so much for coming in, Heidi. This has been fantastic. It's always great having you and talking to you and digging deep into. We always end up talking about something, and it's so much fun. So if you have questions for Heidi, please reach out to her. We'll put her information into the show notes too. And it was great talking to you all. Welcome to my Facebook Live. If you enjoyed this topic or if you enjoyed this episode at all, please share it. Please like it. Please spread the word to your friends, because we do want to let people know that, I had a patient yesterday saying that CBD, isn't that some taboo thing that just people are jumping on the bandwagon? And I told her, yeah, that's partially true, but there is a lot of research and there is some real benefit that could be had. So if you're interested at all in this topic, please share it, and I will see you next week.
Bye.